Hi, I'm John Olsen. I'm a research fellow at the University of Glasgow, and my research is understanding how the places we live, work and socialise can improve our health and reduce population level health inequalities. This research is about 20-minute neighbourhoods, and 20-minute neighbourhoods are a planning concept that is being applied by governments globally. A 20-minute neighbourhood aims to provide residents access to key facilities and amenities required for daily living within a 10-minute walk from their home to the destination, and then a 10-minute walk back home. So thinking about a 20-minute neighbourhood in terms of that journey to and from the destination. Designing places in this way could reduce our dependency on car travel. So if we can walk or cycle to a place within 10 minutes, then we will not require to drive there. And the Scottish Government, within their Living Locally and 20-minute neighbourhood policy, plan to apply the concept nationally. Our research, we wanted to understand what residential addresses in Scotland have access to within their current 20-minute neighbourhoods. We looked at 10 key domains and wanted to see whether Scottish residential addresses had access to them within their 20-minute neighbourhoods. So those domains included green spaces, hospitals, general practitioners, schools, and also healthy food and retail. So our research found that across those 10 key domains, the areas where health status tends to be worse actually have better access to those facilities and amenities within their 20-minute neighbourhoods. And this is largely because the most deprived areas of Scotland tend to be in dense urban areas where they have greater amounts of facilities and amenities. But we did find variation in access to certain facilities and amenities. We found there was good access to green spaces and public transport stops, but there was worse access to facilities like general practitioners. The gaps in our knowledge are around the actual quality of these facilities and amenities within 20-minute neighbourhoods, and whether that varies between the most and least deprived areas. We also want to know whether there's a co-location between facilities and amenities that may be health damaging or may be health benefiting in particular locations in Scotland. Community stakeholders also want to know what encourages people to live locally. Why do people choose to visit facilities and amenities that are local to them and travel by active means by walking and cycling? If we continue our research, we can try to understand how we can design places that are better for population health and well-being outcomes. So we can start to understand which features of the environment encourage people to walk and cycle to local destinations, and what local destinations are important to encourage people to live locally within their 20-minute neighbourhood.